So I think it'd be really important and really helpful to have some reminders around oral chemotherapy adherence, because these folks get their prescription, they go home, they don't see us all the time, and it would be helpful to have reminders for them, questions for them. Did you take your meds? Did you follow up with your pharmacy to get your refill? Are you having side effects that you might not think to call the office for? Reminder, if you're having more than 4 upset tummy moments a day, you need to give us a call immediately, and just things that they might not think about. So I think that would be a really valuable way to use your technology. Just to kind of help prod them, because we can't call them every day, right?
Right. And what's interesting is, having worked at a pharmaceutical company, we create these patient education brochures, but they're usually pretty bulky and they kind of have like everything you need to know, right? And I know if I'm prescribed something, I'm not going to sit there and read the 50 page, right?
We never do.
But what we can do is actually pulse the education so that it's in consumable bites. And so thinking about that, our focus is to figure out how do we use the technology to improve outcomes.
Right.
So if we can pulse education about side effect management, about when they should actually be talking to their healthcare team to figure out maybe dosing should change and such. And so many people actually change therapy and think it failed, but they never really optimized it.
Right. I think that'd be great. I think it's a great technology.
Awesome. So thank you so much for suggesting that, because I'm really passionate about it. But you see, they are too. Some people will actually say, well, I'm only going to use this type of tool for my younger patients, not my older patients. And you kind of said, well, we both together were like, actually older patients would use it. So can you tell me about that?
So sometimes I do find in my population that some of the older patients find that anything technological may be a little bit more challenging, but I do know they're willing to do it. And I know that a lot of families are supportive and kind of helping with these things too. So it's a good resource.
Yeah, and so they would be willing, and what I had added to Jessica, or had mentioned to Jessica, that was when we did our survey with patients, we actually surveyed patients up to 71 years old. 92% of the patients said that they would text for the information if their healthcare professional prescribed it. But the older patients said if they had a challenge, that they actually would just ask a caregiver or a loved one to help them. So my point is that as an advanced practitioner, don't qualify your patients and say, oh, I'm not going to prescribe education to you, because anybody could benefit from it. And if they're not going to do it, guaranteed they're going to figure out somebody that will help them access the content, because you just prescribed education. This is important. You determined that this was valuable to their outcomes.
Personally, I no longer accept those patient education pamphlets. They get out of date when new indications come up, and you receive 50 of them for 2 patients that you may have. And so you end up with a pile of unnecessary documents.
I think every oncology center has a room, a closet, just full. You can't even fit a patient in that room to talk about the information, because there's just so much paper and information, and it's not so much blankets and gloves and hats and pens anymore, but it's just paper, just tons of paper.